Dr. Chauhan, how safe is it to buy Ayurvedic medicines over the counter? Is it safe to take it along with allopathic medicines?
So, I think any medicine should not be bought over the counter. Like allopathic medicines, you have to always get it prescribed from a allopathic doctor. Similarly, Ayurveda is also medicine. Ayurveda is not just some kind of a simple home remedy or something. It's a proper serious medical system. So, I would not advise that people should buy any Ayurvedic medicines themselves, although this is going around now very often. I see people promoting, even advertising, buy this tablet for diabetes, buy this tablet for, but Ayurvedic approach of treatment is personalized. In Ayurveda, if 5 people come to me with diabetes, for example, I will not give them the same medicine to all the 5. I have to see their age, their prakriti, what their constitution, from where they come, what is their origin, what kind of food they eat, what kind of lifestyle they have, what is their mental state, how is like their mental strength. So, many things are considered before we actually decide which medicine will be good for this person. So, Ayurvedic medicine is personalized and should always be taken after consulting an Ayurvedic physician. It is not really a good practice, or I would say it is not a safe practice even, to buy yourself any medicine, and of course not even Ayurvedic medicine. So, the second thing, can it be taken along with the allopathic medicine? Yes, of course, because allopathic medicine normally works at the symptom level, Ayurvedic medicine more works at the cause level. So, we are trying to treat the cause. Of course, we also have other things to be taken care, but normally suppose when patient comes to an Ayurvedic doctor and he has been let us say suffering from diabetes, let us say for 10 years, and he is taking some tablets to control the blood sugar. Now, if the patient comes to Ayurvedic physician, we should not immediately suspend the allopathic medicine. It takes time, So, initially we can go along with both pathies together, both medicines. Slowly when we see an improvement, then the modern medicine can be tapered down. That is how we do. This is an age of integration actually. We should work together. I strongly believe in integration. I strongly believe the future of medical system is integrated. So, we should not be criticizing each other, we should be working together, and that is what we do at Jiva. At Jiva Ayurveda, we have actually created a wonderful ecosystem where we work with a lot of other doctors also, even modern medicine doctors, other systems. We work together, and our main goal is to help the patient. How we can cure the disease of the patient, that is the goal of any physician.
Dr. Chauhan, there is a lot of information on the internet, and people these days have started taking amla juice or giloy. So, is it really safe to take these things without any expert advice?
Well, in Ayurveda, we advise people to first understand their own system, and not just get anything into their system. Every person is unique. That is the concept of Ayurveda. Even if you are not sick, even if you want to just take some juices or something, it is always good to at least know your system, what suits you. Because many times people come to us, then they take some Ayurvedic, some over the counter medicine, and they say, it caused some problem to me. So, that is why it is good to know your system. Of course, there is a part of Ayurveda which is called preventive or rejuvenative. There maybe there are some like Chyawanprash, for example, or you want to take some laxative Triphala tablets, or sometimes you want a little bit of digestive churn. This is fine, you can take that, and you may not really need some expert advice in that. But when it comes to like diseases, serious diseases, so I won't advise you go and buy a over the counter some tablet for your joint pain, or for your heart disease, or for your diabetes, or for cholesterol. That you have to really consult an expert. Of course, as I am explaining to you, the part of Ayurveda which is preventive, which is rejuvenative, you can always get things, but you should still be aware. You should be aware of your system. You should know what constitution you have, what is the strength of your digestive system, what is the strength of your liver, what is the strength of your nervous system, all those things, because again I said one tablet may be good for you and the same tablet may not be good for another person for the same situation or same disease. So, some kind of information is needed. Therefore, we always try to educate people, and this is the goal of Jiva again, to educate people in basic principles of Ayurveda.
There is a lot of research going on in modern medicine, but not so much in Ayurveda. So, how can we consider it safe?
Well, I would not say that there is no research in Ayurveda. There is a lot of research in Ayurveda. Of course, a system which is 5,000 years old and is still running, even if you logically think, there must be some research. It's not somebody has dreamt, one night and he wrote something and it started working and it's still working. So, if you logically think, there was research even from the very beginning. Of course, the research methods in the ancient times were very different. I don't want to bring that point here, it will be too long to explain that. But there was research, whatever is written in our samhitas, in our textbooks was thoroughly researched or tested, I would say. Of course, now we have to retest it, or research the word, we have to research it and do it according to the modern science, which is also happening. Of course, the modern parameters of research sometimes may not be very suitable for Ayurvedic research, because in Ayurveda we take, for example, amla, the whole amla we take, not the extract. The modern approach is you take the active ingredient and then you just try to see on the rats or on the rabbits, which are not humans actually. But Ayurvedic research was on human beings. They tested on humans, everything was properly tested out, and then they wrote the samhitas and the books, and we don't see anything wrong. Even today, all those formulations which were written like thousands of years ago, they are still working as indicated in the books. Whereas you can see in the modern medicine, there is a lot of things not working which were working like 20 years ago or 30 years ago. So, I would say like Ayurveda is actually more scientific than any other science.